Hello, my name is Dr. Harris, and I am going to be your clinical psychologist today. Yes, very nice to meet you as well. So for today, we're just going to get to know one another a little bit. I'm going to be reviewing some of your personal health and family histories. So it's just going to be a discussion between the two of us, a little dialogue, okay? So nothing for you to stress over. I want you to just relax and to know that everything that you say is kept confidential between us today, okay? Okay, great. So just sit back and relax. I'm just going to start by asking you some of these questions. After that, I will also be doing a mini assessment just by getting some of your vital signs today, okay? Okay, great. Alright, so can you please tell me the reason for your visit today? Recent anxiety? Okay. We're going to explore that just a little bit more. Okay. But first, I am going to review a little bit of your background. Okay. So first, can you tell me the race you identify? Okay. And are you currently single, married, divorced? Single? And what kind of home do you currently live in? Is it residential? Is it a home? Is it an apartment? An apartment? Okay. Okay. And I also did want to review, out of the main stressors that can cause different anxieties, which of these have you experienced in the last year, okay? Any criminal victim stressors? Financial stressors? Yes, that's most of us, right? Any housing-related stressors? Okay. Yes, moves can be a bit of a stressor, absolutely. Stress in regards to access to healthcare? Okay. Are you currently employed? Excellent, very good. Any stresses with employment this year? Okay, very good. And are you currently in a relationship? Single? Okay. Not dating at all right now? Okay. Do you have any children? Okay, no children. Have there been any deaths to anyone close to you in the last year? No? Okay. Do you have any medical healthcare problems? Okay. Have you experienced any legal issues? Okay. Traffic violations? They happen. And any abuse or neglect? Very good. And you say you come in because of some anxiety. Have you had anxiety or anxiety episodes in the past? You have? Okay. And is there any history of anxiety disorders within your family? Okay. All right. Any alcohol or substance abuse in the family? Okay. Any violence? No? Okay. And any other mental health disorders within your family that you're aware of? Okay. Are you currently taking any medications? Okay. NSAID? Okay. Yes, anxieties and GI upset often do go hand in hand. right. You're exactly right. Okay, great. Do you have any allergies? None that you're now aware of. Okay. Excellent. Okay, very good. And just to cover all the bases, do you feel that you are currently in danger to yourself or to others? No? Okay, very good. And do you drink? Socially? Okay. And do you smoke? Used to? Okay. And how long ago did you quit? 2 years ago? Good for you. That's excellent. Okay. And in relation to your current episode of anxiety, when did this most recent onset occur? Okay, it started about a week ago. Okay. And was there any particular trigger that you are aware of? Nothing in particular? Okay. And when you say you have anxiety, what are your symptoms? How do you feel? What are the associations with this experience of an anxiety episode? Okay. Yes, those Fitbits can keep a good eye on your heart rate. So it's been elevated. Okay. Okay. Difficulty breathing. And has that been consistent throughout the week, or has it been on and off throughout the week? More on and off for about a week. Okay, great. And have you had any recent treatment changes? Any changes to your medications? Anything like that? No? Okay. All right. And just in review, have you had any types of psychotic symptoms, meaning paranoias, hallucinations, things like that? No? Okay. And have you had any excessive fatigue, irritability, feelings that your worries and your stressors are completely out of your control? Or irritable? Haven't been sleeping as well? Okay. Have you had any associations with obsessive compulsive types of experiences? That's going to be something like if you need to do something for a set number of times, like checking the lock on the door, or having the volume on the TV be set at a certain level, only even numbers, things of that nature. Not that you can think of. Okay. Have you had any eating disorders? You like to exercise, but no disorders. Okay, excellent. And can you tell me about any past psychiatric hospitalizations? You've never been hospitalized for it? Okay. Any outpatient treatments? So you moved here 5 years ago, and before that, you were seeing somebody for a while for anxiety and depression? Okay. Yes, they're very closely associated and often do occur together. Have you been feeling depressed? Overall, you feel okay with that? Okay. You're just having some anxieties? Just trying to figure out your future? Okay. We can try to work through that. Absolutely, absolutely. Okay. Good. In the past, have you tried any medications to help with your depression and or your anxiety? Okay. And how did that work for you? Took a couple of different tries to get the right doses, absolutely. Each person is completely unique with that. It did work, but then you felt better, so you did go off them. Okay. All right, and sweetie, where were you born? And to your knowledge, was it a normal pregnancy and delivery for you? Yes, good. And could you describe your childhood to me in just a couple of words? And you said no abuse in your history, including your childhood? Okay, great. And are your parents still married? Your father passed away. I'm so sorry to hear that. And can I ask how he passed away? Okay. Very sorry to hear about that. And were you ever in the military? No, not for you. Okay. And in any of your past, any legal interactions, any arrests, anything like that? No? Okay. Is there any chance you could be pregnant right now? No? Okay. Alright, we don't need that sheet then. Alright. Over the last 2 weeks, have you been depressed or feeling down most of the day, nearly every day, or not at all? Okay, good. And in the past 2 weeks, were you less interested in most things that you normally find enjoyable? Good. Have you ever had a period of time when you were feeling very up, very high, or hyper on life, so full of energy, that you got yourself into some kind of trouble? Okay. Have you ever been persistently irritable for several days without an adequate reason for that irritability? Okay. In the past month, have you had any persistent fears or significant anxieties about being the focus of attention? And in the past month, have you been bothered by recurrent, distressing thoughts? Thoughts about your future still? Okay. All right, sweetie. So now I'm just going to go ahead and get some of those vital signs, okay? Have you had any surgeries in your history? Okay, you had your tonsils out as a child. Okay. Anything else? Any other medical problems that I should be aware of? And any history of cancer for you? So there's no reason why I can't take the blood pressure from your left arm? Excellent, excellent, okay. All right. First, I'm just going to go ahead and get to that heart rate, okay? hopefully by relaxing here, it is nice and relaxed as well. Okay. Okay. All right, sweetie. So first, go ahead and give me your hand. Thank you. Just getting your heart rate. Very good. Okay. And your respirations, I was keeping an eye on as well. And this is a thermometer. It's just going to go across your forehead for you, okay? It's not going to hurt or anything like that, so just stay nice and still. Okay, 97.9. That's good. Alright, now I'm just going to go ahead and get your blood pressure, so if you can extend your left arm for me, please. You don't need to hold it up. No, just rest it right there. Thank you. Okay. And just stay nice and still and relaxed, okay? Okay, it's actually 128 and 75. That's good. All right, excellent, excellent. Put this away so you don't get white coat syndrome by seeing me with all of my doctor things. Okay, I'll take that off your arm for you. Very good. And now I did want to go over doing a couple of practice activities. These are activities that I think could help you to relax, calm down your heart rate and your blood pressure, and calm you overall when you are having your anxiety episodes, okay? So we're going to practice those now together, but then you can practice them as well on your own. After that, based on my assessment today, I'm going to recommend that you come in twice a week for the next 4 weeks. I want to talk to you a little bit more about what is happening in your life, and also help you out with some of past experiences that may have led you to be having these kinds of reactions to these stressors, okay? But for now, I just want to give you some tools that you can take home with you that will allow you to calm yourself down and relax a little bit. And then moving forward, based on my further assessments and what I learned, I'm debating putting you back on your anti-anxiety medication for a time, okay? Okay, great. So what I want to do first is a breathing-focused exercise, okay? I know it might sound silly, but it works. So what we're going to do together, we are just going to breathe deeply in for 5 seconds, okay? Hold for a beat, and then breathe out nice and slowly for again 5 seconds, okay? We're going to do that a total of 5 times, and I'm going to do it with you. Okay, you ready? So just sit nice and relaxed. Feel your lungs fill up with that oxygenated air. Feel as it fills up the rest of your body with that oxygen-rich blood. Okay? Just be thinking about all that's going on in your body with every cleansing breath that you take. Okay? Here we go. Breathe in. And out. Good. Remember not to rush through it, especially on that breathing in. Everybody wants to breathe in really quickly. Breathe in nice and slowly. Okay? Again. Again. And out. It's okay, you can close your eyes and focus on it. And breathe in. And out. One more time. In. And out. Very good. How did that feel? Feels nice and cleansing. Yes, absolutely. Definitely calms you down. You did excellent. Very good. You can do those 5 times. You can do those 10 times. You can lose count and do them until you feel like you're relaxed. Okay? Excellent tool to have in your back pocket. Okay. The next one is called a body scan. Okay, I'm just going to put this in your notes because I'm going to be bringing a packet that has all this information for you, okay? Excellent. So, everything was good. Okay. Scan, very good. Next, we're going to do what we call a body scan. And for this one, I do want you to close your eyes the entire time, okay? So just sit there, focus on your breathing, just regular breathing right now. Very good. Breathe in and out, and in and out. And while you're breathing, I want you to think about your feet. I want you to feel them. Don't need to move them around. Just let them rest there. But I want you to feel the weight of all your feet do for you all day long. Can you feel the weight? You can tell they feel heavy by the end of the day. Each toe taking on your weight at different times. Think about the sole of your foot, the arch as it stretches every time you walk, the support that each one of your feet gives to you. I want you to feel it on the heel of your foot. Feel all the weight from all that your feet do for you walking around all day long. And then feel up the back of your foot. I want you to think about your Achilles. Your Achilles there stretching over the course of the day with every step that you take, stretching and strengthening. Feel that stretch and the strength just by thinking about it. It works every day for you. And then moving up your leg, think about your calf. Both of your calf muscles are extremely strong. They're what help propel you through your entire day. Think about all the muscles that are stretching and straining all day long to carry you to all of your activities, to all of your events, to work, to the grocery store, and appreciate your calf muscles for all that they do. And then we want to get to our knees. Our knees really feel the pounding of whenever we are running. We feel it even when we walk. Think about the extensions, the bending, everything everything that our knees do to help to keep us moving. Then you want to move up to your thighs. Think about those very, very strong thigh muscles. They are the powerhouse of your legs. Your thighs really do so much to help get you through your day-to-day activities. Think about all the thick muscles in your thighs, some of the thickest muscles in anyone's body. Feel the weight of all the energy they exert to move you about your days. Then you can think about your bottom area. See that smile? But your bottom rests. It's how we're able to sit down right now. But then it's also how we squat. It's going to be an extension of our legs as we walk. It actually does a lot throughout the day to help to get us again from point A to point B. Very, very powerful muscles back there as well. To be thankful. Then we want to get to our stomach, our whole abdominal area, our digestive tract. It's digesting right now whatever you had to eat or to drink today. You have food that is coursing through your digestive system, being broken down. Your body is always active, always working for you. It's working to break down that food so it can absorb all those healthy vitamins, nutrients, and minerals. It's also working to compress the waste so that that can be removed from your body. You want to thank your body for removing any of the waste, by helping you to absorb what your body needs to thrive. You can think about your kidneys. Kidneys are working to filter all of the liquid so that you are able to keep your body's blood circulating, and also so you can keep all the oxygen that you are breathing and have been breathing circulating throughout your fingers, throughout your toes, up to your brain, to your heart, to every part of your body. I want you to think about your lungs. We just felt them breathe in and breathe out. Your lungs are constantly working even when you're not thinking about it. Because of your lungs, you're able to get that oxygen-rich blood to every part of your body. And with every breath that you take, your lungs are working for you. And enjoy and be appreciative and thankful for every cleansing breath. And I want you to think about your heart. You're definitely not thinking about how much your heart does for you every single day. Every moment of every day, your heart is working. It doesn't stop. It doesn't sleep. We can't really control our heart rate to certain extents, but we can help to calm our heart. So I want you to think about all that your heart has done from when you were just a couple of weeks old after conception, right? And up until your very last moment, your heart is going to be working for you. Think about every single beat your heart is going to take in your life, and be thankful and be appreciative. Then I want you to think about your fingertips. Your fingertips. Again, your fingertips are getting oxygen-rich blood circulated from that heart we are so appreciative of. So I want you to feel those fingertips. Okay. Those fingers and those strong hands are what allow us to do most of our activities of daily life. Think about anytime you drive a car, anytime you make a phone call, cooking, getting ready in the morning. Everything that we do uses our hands, uses every one of those 10 fingers. So I want you to think about your thumbs and feel the weight of those thumbs. All that your thumbs do for you to turn every handle, click every pen. Next, I want you to think about your pointer fingers. Okay? Your pointer fingers. They are one of the most commonly used finger, right? We use them for so much from on our phones. They're one of the most common fingers to use. We use them most of the time when we are typing. And we use them to touch most things whenever we're reaching out. So feel the weight and the importance of those pointer fingers. And then we'll think about our middle fingers. Feel the weight of that longest finger for most people. Feel the weight of your ring finger. Very important finger as well. And then lastly, feel the weight of that pinky. And then think about your palms, your very strong palms that help you to grasp and hold so many of the muscles that work each and every one of those fingers. So feel the weight of that hand and be appreciative for all that it does for you every single day. Next, we're going to move up to the wrist. Our wrists are what allow our hands to move in a variety of directions. Think about all the stressors and strains we put on our wrists as we lift items and carry them about, even as we just drive the car. Our wrists are constantly in motion anytime we are using our hands. So just set your hands down there and feel the weight of all the movements your wrists make every single day. And be thankful and appreciative. Next, we're going to move up to our forearms here. And I want you to think about all the muscles in your forearm that can be used and manipulated to manipulate our fingers. As I do this with my fingers, I can feel the muscles in my forearms working. So even when I am not blatantly using my arms, just using my hands and my fingers, my arms are working. My muscles in my arms are working. So just sit there with your palms down and focus on your forearms. Think about every single muscle in your forearm and all that they do for you every day. And then I want you to think about your elbow and upper arm. The bending of the elbow and the strength of that upper arm. They help us when we're lifting things. Once again, when we're doing activities of daily living. And they are very, very often in work throughout our everyday. So feel the weight of your arms. Feel the strain of your elbows. Be thankful. Next, I want us to think about our shoulders. Our shoulders very often need to be lifted up and backwards. Okay? We want to make sure we are holding very good and proper posture. That puts a lot of work on our shoulders and our back. Those are two areas that I really want us to focus on. By focusing on those, we are remembering all the muscles in our shoulders and our back which are connected. So close your eyes if you're not already and think about all of those muscles. Feel the muscles of the shoulders. Think about the muscles of your upper back. Think about how strong they are. They can lift things from the ground and push things up in the air with the help of your hands and your arms. And then I want you to think about your middle and lower back. They are areas where there's often a lot of strain and stress placed. Think about all the muscles that can be worked when you think about them to help to maintain posture so that you do not get any kinds of injuries in your back. And think about all the work that your back and shoulders do for you to hold your entire body up properly. Okay? And then I want you to think about your neck. We don't often think about it as a strong muscular area, but our neck is supporting our head and our brain and our skull. We really need to take the time to think about and focus our minds on the muscles of our neck that work to hold our head up all day long. They work to turn our head and our face side to side. They help us to look down, to look up. They're stretched and contracted. They're very, very strong, and they are working almost all day long to make sure that head stays in alignment and in place. So feel those muscles. Feel the strain in those muscles throughout the day, and be grateful. Then I want you to focus on your head. We are thinking almost all day long. We have stresses, we have anxieties, we have hopes and dreams. We're thinking about things when we're driving. We're thinking about things when we're with our significant other. We're thinking about things even when we're just watching TV. Our brain is constantly going. That causes a lot of stress and tension sometimes around your head too. So I want you to just focus on your head and your skull and all that your head does for you and all that your skull does to protect that brain, which is constantly thinking. And then I want you to start to think about your temples and your forehead. A lot of times that's where we can feel and sense a lot of our stresses and exhaustion. So just focus on those areas. Focus on being grateful for your brain and your head. And focus on relaxing these particular areas. I want you to think about your strong jaw. Without this jaw, we would not be able to be speaking and communicating like we have been. Feel your cheeks, which have muscles that work as we're speaking. They work to help us to smile. And just feel and think about those muscles and let them relax and be thankful for them. I want you to keep your eyes closed. Think about your eyes. Feel the weight of your eyes inside of your head. All day long, our eyes are looking around and assessing information for us. I want you to feel the weight of all the work they do, even when we're not thinking about it. And be appreciative and thankful for your eyes and your sight. And then we can think about our other senses. I want you to think about your mouth and your nose, which allow you to communicate, to smell, to taste, and to breathe. And just take a few seconds, take in a couple of nice, relaxing, cleansing breaths, and detect if there's anything that you can smell in the air. Very good. And then I want you to think about your ears. They're at work all day long too, sensing all the sounds around us, constantly detecting. So just think about your ears and appreciate that incredible sense of hearing that we have. And just appreciate your entire head area as a whole and all that it does for us all day long. And keep those eyes closed and take 3 more nice, deep, cleansing breaths as you feel appreciation and gratitude, as you feel the weight of every single component of your body. Take a nice deep breath with me. take your time. I hope that helped to relax you. You can go through feeling certain parts of your body that you feel need some extra relaxation, tension release, okay? And then just whenever your body feels up to it, you can go ahead and open your eyes, okay? I'm going to be making a couple of last minute notes for you. Welcome back. How did that exercise work for you? Very calming, right? Yes, excellent, excellent. I'm glad that it worked for you. Now, luckily, those are some tools that you can take home with you. Okay? So whenever you're feeling anxious, stressed, I want you to try to take some quiet time away from any other stimulants and just let yourself breathe, and then try to systematically appreciate and relax different parts of your body. And by focusing on those body parts and your breath, you should be able to help to relax and reduce the anxieties within you. However, I do believe that we need a couple of more sessions to delve into exactly what is going on, both in your past as well as in your current life, and see if any other interventions are necessary. So I did write a prescription for you to come in and see me again, okay? And I also have some paperwork here that has some other guided imagery types of resources that you can use to relax, to take your mind off things as well, to vary up some of your mechanisms of relaxation, okay? Wonderful. There you go. Thank you very much, and speak with my assistant if you need to schedule an appointment sooner. Otherwise, I'm going to have them schedule an appointment for 3 days from now. Excellent, excellent. I will see you then. Thank you very much, and I hope that you have a nice evening.